Hey guys, welcome back to my channel. I'm Dr. Upasana Gosalia and this is the third episode or the last episode of my 3-episode series on wisdom teeth. If you guys haven't already checked the earlier 2 episodes where I've talked about what wisdom teeth are, why they cause trouble and what are the different types of treatment options available, then please do check out both those videos in the description box below. And in today's episode, I will be talking about some do's and don'ts or giving you a few tips on what to do after your wisdom tooth surgery or extraction has taken place. For ease of understanding, I thought of dividing this under 2 major categories. Some instructions that you guys need to do before and some others which need to be done after the wisdom tooth removal. So let's start with the before extraction instructions. The first and the foremost, I would say one of the most vital, is don't skip out on your medication. Most likely your dentist would have recommended you some painkillers and antibiotics to start a day or 2 prior to your surgery. And it is very important that you don't miss out on taking these medicines because these medicines ensure that your infection levels are under control and so that your surgery happens very smoothly without a lot of pain. So guys, don't skip out on that medication. Number 2, don't drive. This is again very important. What happens is sometimes because you're very anxious, your dentist might recommend you to take some oral sedatives, something to calm you down before the surgery, and this kind of makes you feel a little lightheaded. So driving in this situation is definitely not something I would advise. It would be like drunken driving. So I think it's best to stay away from driving, and it'll be great if you can have somebody drive you in and out of the clinic, or you could even use a local transport. And the third and the last one to do before your surgery is ensure that you have a proper meal. A lot of times, we're in so much of a hurry or sometimes we're just anxious and we tend to completely forget having a proper meal before the surgery. But this is very important to keep your sugar levels under control and so that you're really relaxed and calm during the surgery. After your surgery has taken place, you won't be able to eat something for at least a couple of hours. So guys, don't skip out on that meal, especially if you are a diabetic and taking some oral medication for the same. What happens is with diabetic patients, we have seen that if they miss out their meal and they still end up having the diabetes tablets, their blood sugar levels are seen to fall down drastically and they then tend to have some symptoms like dizziness, etc. And this can give rise to a lot of complications. So to best avoid this situation, I would say don't skip out on that meal. Have a good one. Now let's talk about what are the instructions or the do's and don'ts to be done after your surgery has taken place. So number 1 and the foremost is ice application. Now most likely at the dental clinic itself, somebody will help you out with an ice pack that you need to apply on your face externally. Now you might have that question, why ice pack and why do I need to do that? Now that is because cold or the ice actually helps with reducing the blood flow over there, and that helps in formation of the blood clot. Forming the blood clot is very important in the initial few hours after the surgery, and hence we advise applying the ice. All you have to do is apply it over your face externally for say about an hour's time. I know it can sometimes feel too cold, so what you can do is just take some short breaks in between, but don't forget to do it at least for an hour's time. And something additional also you can do in order to apply that cold is having a lot of ice creams through the day. Even that really helps a lot. So indulge all you want and have loads of them. The next thing to keep in mind after your surgery is eating a soft diet. Now we don't want to harm or bruise that area which is very tender after the surgery. So guys, make sure that you eat soft for at least a couple of days after the surgery. Nothing too hard or nothing too hot, which can give rise to some inflammation or tenderness. The next tip I want to give you guys is avoid exercising for a day or 2. Now remember guys, you've just been through a minor oral surgical procedure and you really want to keep that area away from all stresses, and by exercising sometimes you may cause some unnecessary blood flow, increased blood flow in that area, or you might end up injuring that area, which we don't want. So guys, no exercising for a day or two. Now the next, I would say one of the most important tips that I'm pretty sure your dentist would have given you, but it is something that we might end up neglecting. So I'm going to stress a little bit on that point over here, and that is, do not rinse or gargle your mouth for at least 24 hours after the surgery. I know after the surgery what happens is, you get a bad taste in your mouth sometimes. Your entire area is anesthetized, you don't like it, you feel like gargling your mouth often. But I think it's best that you avoid it, because what happens with gargling and rinsing is that unnecessary amount of force will dislodge the newly formed blood clot, and you might end up starting to bleed again. Now this situation can be very difficult to control if you're outside the dental clinic and at home. So I think it's best if you follow this instruction properly and stay away from rinsing and gargling at least for 24 hours. And the last instruction I would say is hot water rinses. Now these are supposed to be started 24 hours after the surgery has taken place. Say you had your surgery take place today evening. So next day evening you need to start doing this. Now what the hot water does is, it increases the blood circulation to this affected area, and this is a great aid to reduce the swelling that has come in these last 24 hours, and also it's a great way to tackle your infection levels. So yes, this needs to be started 24 hours after the surgery, and you can do this at least for 4 to 5 days henceforth. I think some of you guys must be confused and thinking I've talked about ice application and now I'm talking about heat. So why this difference? That is because in the first 24 hours, we want your blood to clot, and that clot formation is very important for your healing, as I told you. So now this happens very well in the first 24 hours. This clot which is formed is, I would say, strong enough later to not get dislodged. And that is when we start recommending your hot water gargles in order to tackle your infection levels. So remember, the first 24 hours are going to be ice and cold applications, and after 24 hours it's all going to be about hot water rinses. The last tip that I want to give you guys is, don't forget to visit your dentist for that follow-up appointment. Most likely the dentist would have taken some stitches which need to be removed first of all, and second of all, it is very important for your dentist to have a look at how the healing is taking place. Is it slower than usual? Are you developing a dry socket, a situation wherein the blood clot has dislodged earlier than the normal? In such situations, your dentist might pack that area with a different kind of a medication, which is very important for your healing. So don't forget and don't skip that follow-up appointment. I hope you guys found these tips useful and helpful, and I hope you guys remember them if at all you have to take a wisdom tooth extraction. Do let me know if you have any other questions regarding your mouth and oral cavity that you want me to answer. I'll try my level best to answer them all. And as I say always, stay healthy and keep smiling.